Back pain can drive you crazy, and people will do some crazy things to get out of pain. Being an online low back doctor, I thought I had seen and heard it all since we have clients literally everywhere on the globe. But today I'm going to show you some clips of what people are willing to do to try to get out of pain that left me a little shocked. All right. So I see weights everywhere and oh, okay. Yikes. So he just got yanked in all directions. I think this is called getting drawn and quartered, which was a medieval torture execution style thing in England. But yeah, I don't know how this is going to do for your back pain, yanking your body apart, maybe for decompression purposes. But this is actually called Promotional, which is a Russian form of exercise that's focused on strengthening your body and strengthening your joints. So take it for what it is. I don't know if I'm going to give it a try. Okay. All right. That looks like a giant fishing pole that you would be using to reel in a shark. So, okay. He's getting elevated. Okay. And oh, now comes in a guy. He's grabbing him. What's he gonna do? Oh, okay. All right. He might be a WWE wrestling instructor. Hung upside down, being held, yanked down with full body weight. Once again, this is a decompression type approach, I guess is what they're going for. I might be more worried about the dude's ankles, honestly. Yeah. Not recommending this one for back pain. All right, what do we got here? Oh, okay. All right, so you're just kind of getting hammered up the butt is exactly how this looks. Okay, let me pause it. So there are such things as coccyx adjustments. So coccyx is the very bottommost part of your spine. It's where it ends. Lay public will call it the tailbone. Now, the coccyx can become fixated and it might need a degree of mobilization or correction. And in severe injuries, if someone were to land on their coccyx very bad, it can actually become bent and needs to be straightened out. Believe it or not, that can actually be an internal manual adjustment. Yes, that's exactly how it sounds. The finger would be inserted into the rectum. The coccyx would be pulled and manipulated appropriately to relieve pressure and help it restore back to its normal alignment, if you will, even though I'm not really a fan of that word. But in this particular video, let's keep it going now. I'm going to click play. It looks like he's just kind of getting hammered. And I can't tell if it's too low for the coccyx, so it might be a perineum type muscle hammer. I don't really know. This isn't something that I would come back to. Oh, and all right there, he just used a bigger hammer. Okay. Yeah, I don't think I'm going to go to this guy. So, all right, would not pursue that treatment. Let's watch the next one. Starts with slapping your back. Okay, all right, reverse butt bouncing, yanking on the neck, scorpion walking on your back. Oh, WWE moves, cranking the head, slapping your ear. And the last one actually looks somewhat decent. Super aggressive, super intense. None of these maneuvers are necessary to restore motion to the spine. Any type of manual manipulation of the spine should be with the goal of restoring motion, moving fixated joints, slapping someone's back, putting them in an arched position and pushing down on their back, walking on their back in an arched position. These are not indicated for really any form of musculoskeletal treatment in regards to spine disorders. So maybe it's for show, but looks incredibly aggressive and would be very painful if someone with a sensitive acute lower back issue received this. So no. Hey, real quick. I know you're struggling with pain and obviously want to fix it. So if you just text me the word pain to 317-751-9509, I will send you my free back pain fix demo. Just text that number and you can fix your pain. Thank me later. Back to the show. Oh gosh, we got another hammer. Oh, yeah. Okay. I know that one does not feel good. That's just directly impacting what's called the spinous process. The spinous process is the piece of the vertebra that is sticking out the most. So if you look at someone's spine, you can see the bones that are sticking out all the way down. You can trace someone's spine. That is the spinous process. This looks like a plank of wood with a mallet that's being hammered directly into it. Probably for the goal of, aligning the spine. But that's not going to do it because it's being placed directly on the spine, and that impact can probably cause spinous process fractures. And once again, if someone has acute back pain, that degree of force and aggressiveness is just not necessary. Like, stop it with the hammers. Hanging from the ceiling, locking his body out. Okay. another decompression approach. If we analyze this here, it looks like he has a whole apparatus that's designed to climb up and hang from your roof. His ankles are locked in, and then he's doing basically a reverse crunch. He's, crunching his body up or bending his knees. It's going to use some hamstrings and some core. And then he's slamming his body straight down for that full long axis decompression. Once again, I would be worried about the ankles. I'd be worried about the knees. I'd be worried about the hips. If someone had some contraindications such as previous surgery or prosthetic or instability in some of these regions. But you know what? I'm an advocate of movement and I'm an advocate of exercise. And if this is all the exercise this individual is doing and this is their way of getting moving, then you know what, might be better than nothing. And I want you to comment below which one of these treatments you thought was the craziest that you would never do, or comment one that you would actually consider trying. I'm curious to read. All right, next clip. Senior orthopedic surgeon is what it says at the top there. I think that's a satire. Looks like we have a cement block on top of a cloth on someone's back with a long stick. Okay. And the champ walks that one off. Okay. I guess if you don't have a hammer, you can find a log and place a brick on someone's back and try to hammer the vertebra back in place doing that. Once again, I'm joking when I say this. You can't move a vertebra back in place. The spine is extremely strong. It's extremely rigid. It is just jam-packed with connective tissue. That thing is not moving. So that just looks like pain. That's a no for me, dog. Oh, and this dude is swinging around by his neck. Oh my gosh. He's swinging in circles with nothing but his neck. You can see it's tied down with weights so that he does not fall to the floor himself. Now he's doing crunches. He's doing crunches while hanging by his head. Oh my gosh. What else is he going to do? More circles. And it's to some great music. So, okay, let's unpack this one. Another decompression approach, I guess. Now, maybe he's doing this as some form of cervical exercise, some neck strengthening movements. Just looks a little extreme. I think there's other ways to strengthen your neck. You can do plenty of different neck exercises. You can do neck isometrics by resisting head motion every direction. You can do neck crunches. You can do bridges on your neck. There's so many different things you can do to strengthen your neck. Pulling it with swinging your body around though, I don't know. If someone were to have ligamentous instability in their cervical spine or a potential fracture, this would not be a move you would want to do. And everyone loves to yank their neck for full spine relief, if you will. But even if you do that by a trained professional in a clinical setting, it's still only going to be a temporary relief at best because it's not changing your movement, your function, your strength, anything like that. Swinging around in circles by your neck? Yeah, no thank you. There's actually something called a hangman's fracture that was referencing hanging in medieval times. Once again, well, I guess hangings technically still happen. Ugh, let's not go there. But it's referred to as a hangman's fracture. Now, counter to the name, hangman's fractures are typically induced through extension, hyperextension of the neck, and compression. So this would actually not induce that. But when we see a lot of moves where someone's neck is being pulled, it's kind of said, oh, hangman's fracture, but it's not really the mechanism of injury. So once again, not doing this, not recommending this to anyone I know or that comes into our program with low back issues because this is just a little bit nuts. And those of you watching or listening to this video, I don't want you feeling like you're willing to do the things that are shown in these videos. I know that back pain sucks, but there's better ways to do it. And I'm going to tell you how. And just because you've seen, 3 chiropractors and 3 PTs and I've tried injections and I've been on drugs and I'm in the same position, it doesn't mean you should get crazy desperate and try these things, because just because you tried a couple chiros or PTs doesn't mean you tried it all. You need to try until you find the right provider, because the number one treatment for common neuromusculoskeletal back pain, disc herniation, sciatica is exercise and education. It's the number one treatment. So it means you need the right exercise and the right education. So if you want to see if we can find the right exercise and the right education for you, then I have a plan that you might want to try. And this plan, this approach has helped some of our clients get as much as 37% reduction in their pain in the very first assessment. And then for our full-time clients, it's completely eliminated their pain within as little as 15 days. And this was accomplished through our centralization process, not through these crazy gimmicks that look nuts for internet popularity to try to fix your pain. So if you want to dive deeper with me and actually get a structured plan to healing, just text me the word pain to 317-751-9509 to get a tailored step-by-step plan to permanently fix your back or sciatica issues using our centralization process. Do it right now so you don't miss this opportunity to finally get rid of your pain and live the life that you deserve. And after you text me, please like the video, subscribe if you haven't already, join my private Facebook group, RehabFix Low Back Program, for more free content, resources, and guides. Thank you so much for watching. I'll see you on the next video, and I'll see some of you in the program real soon.